Hey everybody, Dr. Rob here, Facebook Live. Got a great topic today. We're going to talk about ankle sprains. Do me a favor. The information is fabulous. Punch share. Please, as soon as you see this, punch share. Share this information with everybody because, as you all know, everybody at some point has had an ankle sprain or somebody you know has had an ankle sprain. Punch share, hit like. Let's get to it. Let's look right at my little board over here. An inversion sprain is most common. That means you are getting plantar flexion of the foot and inversion. The lateral ligamentous on the ankle sprain is what's most commonly strained. Anterior talofibular ligament for all of you out there. 80% reoccurrence rate. 80% reoccurrence rate. That means the chances of once you have it, you getting it again are obviously quite high. Real shout out to Web Exercises, David Cruz. He does a great job. He has a whole bunch of exercises that we're going to talk about in here today to ensure that you guys can recover from your ankle sprain. The stats, let's do the stats. 28,000 daily. If you just treated an ankle sprain and you're a practitioner, you will have a waiting list practice. 45% of all athletic injuries. Basketball has the highest rate, 41%. Football drops down precipitously to 9.3. Soccer, 7.9. Runners, 7.2. And volleyball, 4%. The stats are first time ankle sprain people. First time you get it, you're going to have what we call CAI, chronic ankle instability, just from the first time, because ankle sprains don't resolve. They don't resolve, they have inflammation. The body's response to inflammation is arthritis. So you're going to get that CAI. Get it fixed right. Price, pressure, ice, compression, elevation is antiquated and deemed ineffective. If you want to get rid of swelling and use a device, shout out to Normatec. They are by far the best choice to get pulsed sequential technology and get the fluid and it exudates out. Got it in the other room, got an upcoming Facebook Live with that. 55% of ankle sprains, people who have it, never seek professional treatment because I'll use this term a couple of times. It's just an ankle sprain. It is not just an ankle sprain. It is a ligamentous and muscle injury that can have nerve involvement, and it's much more vast than people think. It's extremely common, and the numbers dictate that people are not handling it and or treating it correctly. Those with an ankle sprain, check it out. Those who can get it again, those people who weigh more. Obesity is a problem. It changes your moment arms. It changes how you move. It changes how you respond to injury because if you're heavier, you're inflamed. Basically, you'll have greater activities of daily living limitations if you've had an ankle sprain. Clearly, once you sprain your ankle, you're going to walk in an adverse manner. That walking in an adverse manner is going to throw your gait off. It goes to the concept that we talked about a couple of weeks ago with the idea of proprioception and altered motor control. So you're not going to move well. So even if your ankle sprain heals with scar tissue, you're still going to have aberrant feed from your brain causing you not to move well, and you're going to get a cascade of breakdown in different joints, and bigger than that, from the inside out, name of my book, as you guys all know, you're going to have inflammatory issues going on. Finally, you have a chance for increased cardiovascular conditions. Why? Because you can't exercise as much. You can't exercise as efficiently. Not moving, increased cardiovascular conditions. So, it's not just an ankle sprain. It is not just an ankle sprain. Let's go through some modalities that I recommend in exams to ascertain what an ankle sprain is. Single leg balance. Don, I'm going to come over here. Single leg balance. Single leg balance. That is the number one test to see if you're, one, susceptible to an ankle sprain. Then you could always close your eyes. Single leg balance also is the exercise of choice to rehab your injury. Because if you can stand on one leg, and you can stand on one leg, eyes open and eyes closed, clearly you're going to have proprioception and stability around your ankle. Everter muscle, it's starred. If you injure a ligament, a muscle has to be compromised. So it's muscle, ligament, and then bone. If you sprained your ankle, you sprained a ligament, you gave way to muscle. And it's an inversion sprain typically. It's usually your everters, your fibularis or your peroneals, whichever word you want to use. I went to school, it was peroneals. Now they call it fibularis. I'm getting old. Whichever one you want, and that would be longus brevis and maybe even tertius, whichever one you want to call it, that is going to be compromised. So muscle gets compromised before ligament. So you're not going to just treat just the ligament. You're also going to treat the muscle. Remember, he who treats the side of pain is lost in musculoskeletal light. It has an influence, the ankle sprain, on muscles. Well, great story there. I was talking to a particular doctor one day, and he was talking about an ankle sprain as if it was nothing. So to cut to the chase, if you have an ankle sprain, you will have your gluteus maximus shut off on the ipsilateral side, the same side as your ankle sprain. So if your glute isn't firing, you have just lost the strongest muscle in your body, not per square inch. Your glute has a lot to do with the lower back pain. If your glute shuts off, your psoas gets tight, you're going to get anterior pelvic tilt. So essentially, you're now going to have lower cross syndrome. So understand, on the same side of an ankle sprain, your glute shuts off and your hamstrings and adductors have to fire more. So those people who think they have tight hamstrings really have overactive hamstrings in an ankle sprain on that side. Future lateral ankle sprain has long-term risks. We kind of talked about that a little before. Cardiovascular risks for injury. Derrick Rose, what a great example. He had an ankle sprain, and what did he do? His ankle gave way and his knee caved in. Think of all your high school and all your college athletes and all your weekend warriors that sprained their ankle, and what did they do? They taped it. So, if you look at the body as interconnecting joints, some joints are mobile, some joints are stable. Your ankle is a very mobile joint. Your knee is a stable joint. If you tape your ankle so it doesn't move so you don't sprain it, what happens to your knee? It now has an extra strain, it becomes mobile, and then you're going to have structural compromise. Don't tape the ankle. Ankle sprain protocol. Number one thing, call out Erconia laser, the leader in laser medical treatment. Laser the ligamentous side. Erconia laser therapy works at a cell level, so you don't feel anything because you're not feeling the heat. It's working via mitochondria, will speed up the ligamentous healing exponentially. Myofascial release. I skipped one, I'm sorry. Ligamentous, also muscle and also nerve. The 635 of the Erconia laser wavelength is the visible light. By the way, laser light, people ask, well, how does it go through the skin? It's real simple. It's been proven to go through the skin and the skull. Has anyone ever seen a child that was like yellow, neonatal jaundice? Well, what do? They take them and they move them into the sunlight. That proves that light, laser light, passes the skull and passes the skin. So the laser is able to permeate and penetrate skin, go through the cell membrane and heal different areas. It has a positive effect on ligamentous, it has a positive effect on muscle, and there is a nerve traction injuries in more than 50% of our ankle sprains. 635 nanometers has the proper action potential to help heal a nerve. So Erconia laser is a great choice for an ankle sprain. Myofascial release, active release, factor PM, any of these things where you're going to release the myofascia. Everything outside of the joint, cartilage, ligament, soft tissue, and the big guy, fascia. We're getting there, guys. Trying to move along. Proprioceptive training. Proprioceptive training, just like Meyer DC has in performance health. Wobble boards, rocker boards, and the like. Real great choices to be able to what? Proprioception. Balance between your nervous system and your muscular system, all using your brain as a great big chip. Eversion, inversion exercises. Once again, Web Exercises has them. Eversion and inversion. You want to strengthen the ankle for stability. Mobilize and manipulate. Well, yeah, all the joints in the foot and above. There's a whole bunch of foot adjustments. A lot of my patients get adjustments of the foot, and there's a whole litany list of things you can do to the different joints, whether you want to do a little high force mobilization, manipulation, or just some low-level mobilization. Range of motion. You want to get that range of motion in the ankle. Remember, it is an active joint that moves a lot. If it gets stiff, you're losing motion there. That's going to, again, lead to a cascade of an injury once again. Normatec, we had talked about it before. Get the swelling out. Normatec, you started all the Olympic teams. It's like virtually in every locker room now in all the professional teams. Normatec is a choice for sequential pulse technology And finally, quickly, Nutritional Protocols. Metagenics, Nutridyne, my choice. Here's what I recommend. Proteolytic enzymes, take them in between meals. Natural anti-inflammatories like turmeric, boswellia, ginger, quercetin, cayenne, all a great choice. Added with the proteolytic enzymes, add a little magnesium, calcium, and some herbs like passion flower and valerian root. We call that acute phase. First thing when somebody comes in, give them the acute phase. It's a nice packet. Anybody needs any acute phase, come give me a call. That's what I would do in the first 3 days. You use your acute phase package. You want to make sure that soft tissue heal. You want to make sure that it doesn't go from tendinitis to tendinosis. My recommendation is a product called EC Matrix that blunts the release of excessive proteolytic enzymes like matrix metalloproteinases. Great formula in there's a sperm. There's berberine. Berberine is the new player. As far as I'm concerned, I can do a whole Facebook Live on berberine. It works with 4 different organs. Berberine is really the sexy new thing of the year, of the month. It's in all my upcoming seminars. Selenium, biotin, and zinc. EC Matrix is a great choice. Remember, you have to take care of your health because it's the only place you guys have to live. Any questions on ankle sprain? info@drrobertsilverman.com. Give me a call in the office. Thanks all my vendors for doing such a great job. Always yours in health. Please share this. Dr. Rob.